The healthcare system in rural America has been pushed to the brink. Medical workers putting in long hours and patients forced to travel miles to get quality care.
More than 60 million Americans live in communities that lack essential medical services like maternity care. Since 2010, there have been 149 closures of rural hospitals in the U.S. 82 of those were complete closures, while the rest were converted to facilities only offering emergency services, but no inpatient care. Researchers at the University of North Carolina at Chapel Hill have found the primary reasons for these closures include worsening economic inequality and financial dependence on Medicare and Medicaid payments.
Reporter Peter Zampa speaks with a patient working to navigate an overstressed system and the healthcare workers searching for solutions.
I love the outdoors, getting outdoors, enjoying the community and the people here.
Bonnie has lived in Northeast Vermont for much of her life, but living in a remote area suddenly turned complicated.
About 7 years ago, I had sudden hearing loss and I couldn't hear anything. There was nobody here that could figure it out. I had to call a friend in Illinois and they actually helped prescribe something, and if I hadn't reached out to her, I would have been permanently deaf.
Now Bonnie's seen 3 specialists at Dartmouth Medical Center, 90 minutes from home.
Sometimes it gets to be overwhelming and you get tired.
Long distances also a problem for Calix, the ambulance service in St. Johnsbury. They take calls up to an hour and a half away.
How often does it seem like you're too late?
Cardiac arrest is the one call that time is of the essence. So you have roughly about 8 to 10 minutes to get someone there with high quality CPR and an AED on their chest. Similar, if you're bleeding out, you will bleed out by the time we get there.
Michael Wright drives us around as his radio blares with typical calls.
It's going to be a male in his 30s, believed to be overdosing.
He says the region is older, poorer, and dealing with an opioid epidemic. Here in Vermont, about 75% of rural hospitals are operating at a loss. Take Northeastern Vermont Regional Hospital. It has an ER, birth center, surgical services, and more. But there are some services they just can't provide with their limited resources.
We lose a lot of money on Medicaid because it does not reimburse at the level that covers the cost of delivering the care. Medicare is a little bit better. And when you have a small rural state with a fragile economy that can't sustain a strong employment base that has a lot of commercial insurance, it inherently makes the mix very fragile.
Then there's the issue of staffing. Lower pay and a lack of housing in the area make recruitment and retention hard. That means the employees they do have are stretched thin.
I love doing this job, want to provide for my community and be there.
A report in February 2024 by the health consulting firm Chartis found that more than half of all rural hospitals lost money in the past year. It also found that more than 400 of these hospitals are vulnerable to closure. For more of our in-depth coverage on these rural hospitals, you can go to investigatetv.com. Just search rural hospitals in the search tab. In New York, I'm Peter Zappa.